Dr. Helen Fernandes is chair of the Doctors Association UK and consultant neurosurgeon in Cambridge. I've got to confess, Doctor, I'm coming a little late to this, but I'm obviously reading with some concern. How worried should we be about physician associates in your book? Good morning.
Good morning, Nick. Well, DA UK and the BMA and the Royal Colleges who oversee doctors' training and education have been calling for this sort of review for nearly 2 years now, and we're very grateful that the review will now start and look at the role of PAs and the AAs in the medical workforce.
Sorry, what's an AA? Sorry to talk over you.
An AA is an anaesthetic associate, so it's the same thing as a PA. They can give anaesthetics to patients. And
hang on, I could have an anaesthetic, or someone I love could have an anaesthetic given by an AA, not an actual anaesthetist?
Yes.
Good
yes,
God.
So not medically trained, as in not a qualified doctor. And this was brought into sharp focus last year when a law was passed stipulating that the regulation of these health professionals should be by the General Medical Council. And what has been of great concern to the doctors and the colleges, as I've said, is that the GMC will not actually set out a regulatory framework that will tell PAs and AAs what they can do and what they can't do. That will be up to each individual NHS employer. Let me give a simple example for the listeners. I'm
Please.
a neurosurgeon. It's taken me 10, 15 years to train as a neurosurgeon. If one day I decided that I didn't want to do that anymore, and let's say I wanted to be a paediatrician, I would have to competitively get a job as a trainee paediatrician and then perhaps spend another 10 years training up to become that children's doctor. A PA and an AA can step between different medical specialities depending upon what jobs are available out there and what trusts choose to allow them to do. And that's what we don't want to happen. That's what needs to be reviewed and changed.
Might I ask you a question? I imagine this is going to come down to pounds and pence, or pounds, shillings and pence. Why do we use them?
I have absolutely no idea.
Maybe they're cheaper, are they?
Not necessarily. They're actually more expensive than hospital doctors. And I can tell you that millions has been spent already sort of furthering this scheme. I think the GMC probably is in receipt of £5 million or more in its preparation to regulate PAs and AAs. So in the hospital setting, they are more expensive, but in general practice, they cost possibly half, if not less, than a qualified doctor.
I will leave it there. Doctor, thank you for your time. Dr. Helen Fernandes is chair of Doctors Association UK and is a consultant neurosurgeon in Cambridge. I'd love to hear from you.